Hello, my name is Luciano Garcia, Assistant Professor at Texas Women's University at the Institute of Health Sciences in Houston, Texas. I want to talk to you about my study, The Effect of Executive Cognitive Distraction on Sustaining a Volitional Preemptive Abdominal Contraction during a Unipodal Functional Movement in Healthy Subjects. I'd like to first thank my colleagues at Texas Tech, Bill Sizer, Troy Hooper, Jim Jean-Michel Brisbane, as well as Alex Drosch and Hyung Yang. Introduction. Daily distractions can affect the muscle performance during a functional task. Rehabilitation professionals should demonstrate a better understanding of these cognitive distractions on trunk and lower extremity muscle activation patterns. Executive cognitive distraction, also known as Stroop effect, is an auditory or a visual diversion which can influence neuromuscular trunk control during functional activities. The objective of my study is to determine the effect this cognitive distraction or Stroop has on the ability to maintain a VPAC, which is an abdominal bracing maneuver, in healthy subjects while they perform a unipodal functional task. So the subjects will perform abdominal bracing maneuver or a no bracing maneuver condition with or without Stroop distraction while they perform the Y balance test in the three directions. If you look at the picture in the middle, I have it labeled number 1, that's the anterior direction. Number 2 is labeled the posterior lateral direction. And number 3, the posterior medial direction, all of the Y balance test. You will also see some headphones on the subjects. How we do the cognitive distraction is they will hear some terms. They're going to hear terms in their headphones, all pre-recorded. They will while they're performing each condition, they will hear 5 terms in their headphones. If the stereotypical term is female, they will lift their right pinky in the air to note that it's a stereotypical female term. If the term in the headphones is male stereotypical, then they will lift the left pinky in the air. What makes it a little more challenging is the voice that is speaking the term is not necessarily a female or male correlated with the term. So they might hear, let's say, the term lipstick, which is stereotypical female, but in a deeper, lower voice. So there is some challenges on how their brain can interpret this while they're performing the movement. Our method is within subjects, repeated measure of a cohort, all performed in a clinical biomechanical lab, and we recruited the subjects from the local community and the local university. We studied 30 healthy subjects ranging from 20 to 41 years old. We used surface EMG on both sides, either the moving or the stance internal oblique and external oblique, while they performed the YBT in the 3 directions already described. And I also already described the Stroop pattern. With the headphones, they will hear the 5 terms while they're performing the movement, and they have to lift the corresponding middle finger, right for female, left for male. We used a 2x2 repeated measure ANOVA to look for interactions and main effects for each direction of the YBT. The results, we found that the 2x2 repeated measure ANOVA produced a main effect for VPAC strategy in all directions of the YBT, where both the internal oblique and external oblique, the root mean square of the EMG amplitude, all directions increased significantly during the bracing maneuver. A separate repeated measure ANOVA found that, and this one looked at reach distances. So not EMG amplitude, but reach distances. It found a main effect for Stroop only in the posterior medial YBT direction. That's the direction labeled number 3 in the picture in the middle, where the mean reach distance was significantly higher than the non-distraction condition. So by having the distraction and having to cognitively challenged, that produced a less reach direction in number 3 direction. So in conclusion, our study revealed that healthy subjects were able to perform a VPAC, which is the bracing maneuver, during a unipodal lower extremity reaching task, even when cognitively distracted. YBT reach distances were affected by the Stroop distraction only in the posterior medial YBT direction. This study will serve health professionals on the effect that this distraction has on the VPAC during the Y balance test, which can be incorporated in an athletic activity or a recreational activity or in a ADL activity as well. Thank you very much.